All right, guys. Today I am here with Dr. Mitchell from Mitchell Medical PC. He is an expert when it comes to addiction medicine. He's a board certified physician, and I would say he is a specialist when it comes to detoxing people at home safely. And today's conversation is going to revolve around a legal substance, kind of in a gray area, called 7-OH. 7-OH has gained tremendous popularity over the last several months, and we're seeing it all over TikTok, YouTube, social media. Everyone's talking about it. So today, I'm glad to have Dr. Mitchell on to educate us a bit more about this drug and educate us a bit more about what the withdrawal looks like, what the detox looks like, and help people kind of sort through this mess that it's created in people's lives. So, Dr. Mitchell, why don't you give people a little bit of a background regarding your addiction medicine practice and what exactly it is you do and what got you into this space?
I just do addiction medicine 24/7 in our practice. I have a private practice where I see patients monthly. And for the last 15 years, I've been detoxing everybody at home. I have a tremendous success rate doing it that way. They're in the comfort of their own house, they're in their own bed, they can get food when they want to. And I believe the medication I use is more than sufficient to help them get over the withdrawal phase of whatever drug they're on or alcohol. I started out as a pediatrician. I had a practice in Manhattan. I was in the Village. I had a very big practice. I wrote a book called The Pill Book Guide to Children's Medications. And I was doing that for over 20 years. My brother had a drug problem since he was 15. I used to call him all the time because I always was worried about him. And he'd go a year or two sober. He was able to go to college and finish at Ohio State. He went to the Culinary Institute and finished there. He was a smart guy. And as I said, he did mostly pills and drinking. And then he had a child and he was divorced. So his ex-wife and child moved to Ohio. So he moved to Ohio to be closer to them. And to make a long story short, he met this person, started doing heroin that went from sniffing to IV very quickly. And as I said, I was called him every day. And I didn't get a call from him. One day when I called the office manager. I said, can you please go to his apartment and see how he is? And the person there laughed at me. He said, your brother is 40 years old. He's fine. He didn't call you for one day. So after me really getting angry, I said, just do me a favor. He went over to the apartment. He opened the door, and my brother was dead on the floor in the kitchen with the needle still in his arm. And the coroner told me that he was dead before he even hit the floor. So I didn't know what to do with myself after he passed away. I sold my practice to my associate, Lisa. And then I went back and I got trained in addiction medicine. I was board certified by the American Board of Addiction Medicine that now switched over to the American Board of Preventive Medicine in Addiction Medicine. So I'm board certified by them. And I'm also a fellow of the American Society of Addiction Medicine. And as I said, this is all I do is addiction medicine. I live, breathe it, try to help as many people as I can.
Yeah, and I've seen firsthand you help people. I know me and you recently connected on an at-home detox for a gentleman who was consuming upwards of 35 beers a day. And I'll say with your wizardry and your specialty in medicine, I watched him go through 4 days very comfortably of minor withdrawal symptoms and come out on the other side of that extremely successfully. And this is someone who had gone through rehabs and had horrible experiences in and out of rehabs and this and that. And he had really lost all hope because of his physical dependency to alcohol. And you walked him through that as if it was nothing. That was just a walk in the park, actually. So I've seen firsthand your expertise at work when it comes to at-home detox. Now, with that being said, I know you guys have been doing a lot of work lately with 7-OH, and that's really what I want to talk about in today's video. So tell me a little bit about what exactly is 7-OH? Is it kratom? How does it compare to opioids and other drugs? Give me some background on 7-OH and what it actually is.
Well, kratom is a plant from Southeast Asia, and a very tiny part of 7-OH is on the kratom plant, but it's minuscule. It's like 0.005%. It's nothing. But when you take kratom, it gets metabolized in the liver into 7-OH, and that's where the analgesic effect from kratom occurs, is because it changes into 7-OH. But 7-OH is mainly synthetic. It's made man-made, and the problem is there's no regulation. It's been banned in about 9 states so far, and hopefully within the year it'll be banned throughout the country. But you know, people can still get it by mail order, unfortunately.
And people are finding this at gas stations, they're finding it at vape shops, just pretty much anywhere where it's still legal. Or illegally, places are continuing to sell it as well, as far as I'm aware.
Yeah, no, listen, I've had patients that I detox that went into a head shop that never did a drug in their life and was just looking for something to calm down. I had a couple from Florida who had an autistic child, about 14 years old, nonverbal, would grunt, get very frustrated, and then get physical. So these parents that never touched a drug in their life went into a head shop and said, we just want something natural that after our son is asleep, we can just like mellow out a little bit and then watch some TV and relax, because they both worked from home because they had to take care of their son. Well, about a month later, they're going on vacation. And when the plane landed, the husband's shirt was soaking wet. The wife was running to the bathroom, holding her stomach. They had no idea about withdrawals and that this could cause withdrawals. And then they found me, I think, on TikTok. And I detoxed both of them, and they are doing terrific. And this is probably about 6 months ago.
So a lot of people getting involved with using 7-OH, I think, are pretty unaware of how the dependency develops and how kind of the addiction develops. Like you said, people are going into a vape shop, they're thinking nothing of it, a head shop, whatever. They're being told it's this natural thing, it's great for X, Y, and Z. So can you explain a little bit what a dependency looks like? Like, how does that develop with 7-OH specifically? Like, how does dependency or addiction develop? And you can feel free to delineate between those two words and whatnot.
Well, what happens with 7-OH is 7-OH is a very short-acting drug. The half-life is 2.5 hours, which means within 2.5 hours, half of that drug is out of your system. So people who continue to take it become physically dependent on it and have to keep taking it. But as they become physically dependent on it, their tolerance increases, so their dose increases. So you can get, a euphoric feeling from 7-OH just taking 2 to 5 milligrams the first time, and people feel great, and they continue with it, and they don't realize that there's physical dependency, and then addiction develops. And people that are calling me to be detox, usual range is anywhere from 600 to 1,000 milligrams a day they're taking. And I've had some people as high as 2,300 milligrams a day. So it goes up so quickly that people don't realize where they're at with it. And it's not inexpensive. It's very expensive, drug that they sell.
And it sounds like some of the people, like you were just referencing these two parents that you worked with, it sounds like a lot of the people that you're talking about, they're not out here seeking some substance or some alternative to opioids or some other drug like that. It sounds like these are individuals who didn't have, per se, any history of substance use. Maybe they're working professionals, they're parents, and they just kind of stumbled into this dependency or tolerance unknowingly. Is that a fair statement regarding some of the people that you work with?
It's a very fair statement. I mean, we have a lot of people in their late 50s, early 60s that go into a head shop or a gas station and ask about the product because they have a sore back or, something to that nature. And they said, oh, take this. It's great for your back. It's great for anxiety. They tell them it's great for everything, but they don't tell them the downside of it is that you're going to get addicted to it. And the withdrawals as I said, I've been detoxing people for 15 years, from alcohol to benzos to opioids, fentanyl, you name it. I detox people at home. This is by far, in my opinion, one of the worst one of the worst withdrawals that I've ever seen. It affects people, get restless legs, but they get restless arms. I had a woman in New Jersey whose arm kept flapping up and down when she called me, and she couldn't stop it. And this is what happens with this product. But as I said before, there's no regulation. They have found arsenic and lead in 7-OH. They found salmonella bacteria in it. There's synthetic opioids. I mean, there's been a whole gamut of other products that are thrown into this, because it could be made in someone's garage, or, it's not made in a lab in a pharmaceutical company, that's for sure.
It's sold as a supplement, correct? For the most part, I believe. Yeah,
Yeah.
as a dietary supplement.
Yeah, as long as they're not saying it treats X, Y, and Z, they're able to get under the radar and get on the shelves. They can't make any claims, and that's how these companies have been able to put this out, as you said, in gas stations and head shops, vape shops, all over the place. I mean, you can't walk more than a block without seeing signs for 7-OH and kratom in the windows.
Yeah, I see it everywhere. So, what would be, and you kind of already touched on this, what would be some of the most common reasons that people look to utilize 7-OH? You mentioned back pain. I think you mentioned anxiety. What are some of the reasons that people are drawn to using this substance or told to use it for?
It could be all of those that you just mentioned. People go in there, they're very anxious. They tell them it works for anxiety, or back pain is a big one. And there are also people that, let's say, are addicted to oxycodone and are told, well, if you take this, you'll be able to get off the oxycodone. Yeah, you might be able to get off the oxycodone, but now you're addicted to 7-OH. But they don't tell you that part when they talk to you about getting off of oxycodone or any other opioid.
So, aside from developing, which can obviously be catastrophic for a person, a dependence and a tolerance and the whole cycle of addiction and all the consequences of that can lead to, what are some of the ill effects that someone might experience who's been utilizing 7-OH for a long time? Like, what are some of the side effects of active 7-OH consumption that people would need to be aware of?
Well, I mean, it's the same thing that, from taking any kind of opioid besides, the physical and mental addiction. I mean, it takes over your whole life. I always tell patients in my practice, doing opioids or doing 7-OH, it's like having a second job. You have to make sure you have enough of the drug for the day. You have to have enough when you wake up in the morning. It consumes your whole life. And physically, it takes a huge toll on people. People get severely constipated on 7-OH. Opioids is always constipation, but there's some people that have gotten such bad constipation that they haven't gone in the bathroom for a week, that they're rushed to the hospital because they have to be evacuated, and some people have needed surgery. So there's a lot of terrible side effects.
All right, Dr. Mitchell. So now that we have a good understanding as far as what consuming 7-OH does to a person's body, you can get the constipation, this, that, the consequences of addiction. Let's say someone gets fed up with that and they say, okay, I'm going to stop. Now, when a person goes to quit, what type of withdrawal symptoms do you usually see patients experience?
They get more or less the same as it would with any opioid in the beginning. They'll get the runny nose, the eyes tearing, the sneezing, the diarrhea, restless legs. All those are symptoms of withdrawal. With the restless legs, as I said, as this being probably one of the worst withdrawals I've ever seen, it affects not only the legs, but it affects the upper body. I've seen people get cramps in their arms from stopping, 7-OH quickly. Tapering, I've seen people try to taper. They'll try to taper down slowly. It's very difficult to do because it's such a short-acting drug that, as I said before, the half-life is only 2.5 hours. So to try to keep up with that and lower the dose at the same time becomes very difficult for a patient. And I haven't seen anyone that's called me yet that has been successful that way. I'm sure there are plenty of people that have done it, but I haven't. Those aren't the people that are calling me. The people that are calling me are the people that stopped it, might have pause, that they have symptoms that are lingering. They're not sleeping. Sleeping's a big one with 7-OH. The people that are taking, even when they're taking the 7-OH in the beginning and they think they feel comfortable, they're really never getting into a good night's sleep. And then when they try to lower the dose, the sleep goes out the window. They're not sleeping at all. And if you're not sleeping, it affects you mentally. You can't think clearly. It affects your whole life.
For someone going through 7-OH withdrawal in a non-medically supervised setting, I would think that there could be instances where that could lead to a potentially dangerous situation for a person. If they're going through prolonged bouts of insomnia, I assume at that point too, mental health starts to crumble a bit. Crazy amounts of anxiety, I would assume, are associated with it as well. And I would think that that could put someone in a potentially compromised situation if they're not doing this correctly. And like I said, things like this, we usually talk to people about medically supervised detoxes for those reasons. What does a detox timeline look like? And I'll just ask you in relation to what you do with a person and an at-home detox. Like, what does that timeline of detox look like from 7-OH? And how comfortable can that detox be if a person has the proper care?
Well, I speak to the patients. I get a good history, their past history. I ask them if there's any previous opioid use or alcohol use. I want to know if they had a substance use disorder before. And then I find out how many milligrams they're taking, how often they're taking, and then I'll come up with a plan. So it's not like I have a boilerplate ready to go that I just hand out sheets to patients. Everybody's different. Depends on the amount of 7-OH they're taking. But after I get a complete history and I go through everything, I'll give them comfort meds for at least 24 hours or longer. And then I'll taper them with another drug for a few days. But I just want to make it clear, I don't take people off of a medication that they're addicted to and put them on something that they're going to become addicted to. I always get these questions from patients. That's not what I do. I try to make them as comfortable as possible. I just had 2 patients call me this morning that I detoxed about 2 weeks ago that just called to thank me because they told me they had absolutely no withdrawals during the whole detox process. Now, is that with everybody that I detox? No, but I've never had anybody in severe pain or terrible withdrawals with the medication that I use.
I can tell you from the gentleman that we collaborated on his detox, 35 beers a day down to 0 safely under medical supervision. His largest withdrawal symptom was he said he felt somewhat fatigued. And that was it. There was no dry heaving. There was no sweating. There was no horrid insomnia. There was no shakes. There was certainly no seizures. It was really unbelievable to see someone go through what he had gone through for the last several years and to walk away from that over a 4-day period with just a little bit of fatigue, which we also addressed and you corrected as well too, was pretty miraculous, if you ask me. It's really amazing.
When I'm detoxing them, and after that, then you're right. I give them medication so they don't have fatigue, and then I talk to the patient, which I believe is very important because there are a lot of people that could probably detox people off of 7-OH, but I talk to the patient after the detox and talk about medications that I give them so they don't relapse. And that's real important because for me, just to detox someone and say, okay, you're detox, you're great, go on with your life, that's difficult to do that, especially if they have a previous opioid problem. They need medication that'll help them prevent to get urges to use the drug again. And that's what I do when the detox is over.
So this brings me into another topic as well too, and I would never discourage someone from trying whatever it is they want to do to get off of substances. but I have seen countless people go in and out of rehabs like a revolving door where they are not set up with any long term solutions, any long term plans, whether it comes to stuff like I do, working on a person's mindset, or when it comes to like medication for people. Is this something that you've seen as well? Because I've had countless clients in and out of 6, 7 different rehab facilities. They get 30 days there because they were coursed into the rehab and then they didn't have access to anything. And then they come out 30 days later, 90 days later, and they're like, yeah, I started drinking again. I started using opioids again. I started using it as soon as I got home. Do you see that as well, too?
I see that all the time. That's why I detox everybody at home. Rehabs, and you're correct. Over 70% of the rehabs in this country will discharge someone after 30 days without any medication to help them from relapsing. I'm sure there are great rehabs out there. I'm not saying
Sure.
anything, but most of the rehabs that I see and patients that come to me that I agree that have been in and out of 6, 7 rehabs, in a short period of time. And the major complaint they usually tell me is that they weren't given, enough medication, so they felt terrible the whole time. So their brain, all they could think about is using or drinking when they got out, so they could feel better. And that's one of the major complaints I get from people that go into rehabs. The medication, and then they have to wait. I mean, they might not feel well, but medications are given exactly at a certain time at these rehabs. And if someone is not feeling better, you know, or feeling worse and they're not getting medications for another hour, you're not doing them any kind of service. So I find that all the time with rehabs. I don't believe they give enough medication to make people comfortable. And I've heard from patients that they've had to wait an hour, 2 hours before they even came around to give them their medications.
Yeah, it's really a dangerous scenario because then what happens is a person goes to a rehab thinking this was going to be the solution to it. They may not receive the proper care. They come out, they're then thinking, oh my gosh, this thing that was supposed to help me, that was supposed to work, didn't work. Not necessarily because the patient did anything wrong, but because proper care wasn't provided. And now it just creates even more of a hopeless loop for a person. And I've just talked to countless people who've been in that situation where it's like, hey, look, it wasn't you. You weren't given the right tools. You weren't given the right support. You weren't given the right care to actually make this successful. So it's a sad scenario that I've come across far too many times. Dr. Mitchell, that brings up another point too while we're talking about rehab. So as I said at the beginning of this, 7-OH is kind of like a newer thing. And I'm going to venture to guess that most rehabs don't have a lot of experience when it comes to 7-OH detox. And I'm going to guess they're kind of throwing crap at a wall to see what sticks. Now, I could be completely wrong, but I know from my experience, even working with people, I do a lot with cannabis substance use disorder. And if you walk into a rehab with a cannabis substance use disorder, they don't know what to do with a person. I've seen this time and time again. And I would imagine 7-OH is even more of a disaster than that. Do you have any commentary on that?
No, you're 100% correct. I've had patients call me that have gone into rehabs specifically to get detox or 7-OH, and they had no idea what 7-OH, was. And there are also a lot of these places that will put people on Suboxone for 3 to 6 months, but now they're addicted to Suboxone, and so you have to worry about taking them down off of, Suboxone. So that's why I said I don't. When I detox someone, I don't give them medications long enough for them to get physically addicted to any of the medications I use, because you don't want to, as I said before, take someone off something that they're severely addicted to and then put them on something that you're helping them, but put them on too long and now they're physically addicted to this medication.
And this is something that you've seen happen with 7-OH before. You've had people call you winding up in this scenario.
Yeah, no, I've had a lot of people call me to ask me to help them get off Suboxone because they were placed on Suboxone for 6 months and they never wanted to do that. They just wanted to get healthy and then find a medication that would help them with urges. And there are medications out there that you can take that'll help you with urges that you don't get physically addicted to.
Yeah, I think that's always a concern with people. And that's where we have an appeal to people like, being an addiction recovery coach, I can't prescribe, and that's why it's lovely coordinating with people like you who are able to do medical detoxes with people at home who do it responsibly, comfortably, and easily for people, because that's always a concern, right? Like when I would, send out or try and collaborate, it would just be we're trading one drug for another drug. Maybe there's some harm reduction, but at the end of the day, it's not like a massive amount because then the person has a problem with that other drug now. And we're just like, wow, somehow we wound up back where we started, which is just a massive problem. So I'll say this, Dr. Mitchell, would you have any word of caution or any word of advice to people? So if someone is looking to use 7-OH for back pain, anxiety, this and that, what would you recommend to them? Would it be just like to do their research before getting into it? Would it be to stay away from 7-OH completely? Like, what would be your word of advice?
My word of advice is to run far away from the head shop or the gas station as quickly as you can. Do not get involved with this drug because it will mess up your life. It is a terrible, terrible drug. And
I
as I
hope
keep saying, the withdrawals are horrendous. They are so bad. I feel terrible for people that call me that have tried to get off on their own. They're just miserable.
I've had a number of people, and this is why I was excited to do this video, who have been in the process of quitting cannabis. And they'll say, oh, yeah, the guy at the vape shop gave me 7-OH. He told me it helped me with the withdrawals. And I'm like, whoop, let's not go down that road because this is about to get a lot more complicated. So I'm like, let's just pause right there. Let's backtrack now. Let's focus on one thing at a time. All right. So, well, Dr. Mitchell, this is really a fantastic conversation. Now, for those of you who enjoyed this, I'm going to put a link to Dr. Mitchell's information in the video description and the pinned comment. We'll have a link to our service as well in the video description and the pinned comment. But if you contact us or contact him, we can get you guys in touch with one another. And I really appreciate you taking the time to be here. There's a lot of other substances that people ask me about on my channel, and I don't talk about them, not because I don't have experience in helping people come off of them from what I do from a recovery coaching standpoint, but it's because there is a medical detox necessary. So, for example, we take alcohol. I'm happy to make videos about alcohol and help people with the mindsets and all that stuff. But if I got someone who's drinking 35 beers a day who decides to stop overnight, we now have a serious problem on our hands. That person is at serious risk. So I hope in the future, me and you can have some more conversations regarding alcohol, opioids, other various substances that people have been struggling with, because I think there could be tremendous benefit from these conversations to people out there.
Yeah, and then real quick before we go, anybody that is on alcohol and drinking every day or is taking a benzodiazepine like a Xanax or Valium or any of those for a long period of time, please do not stop that cold turkey. You can have a seizure and die. It needs to be medically detoxed, please.
Yeah, that's huge. And there's not many people out there providing services like you do, very few and far between. So really, it's awesome work that you guys are doing. Well, thank you for taking your time to be here today, Dr. Mitchell.
Well, thank you. Thanks for having me.
Yeah.